Welcome back, Chronics, and thanks for joining me. Today we're talking about nutrition and gut health. Yeah, I'm still in the stomach kick. If you didn't see my last episode, I have to wait 6 months to see the actual gastroenterologist that's going to help me. It's okay, I'm just calling 5 times a day, so they're gonna cave and I'll probably see them next week. Hey, if you have to be a little delulu to keep a positive attitude, it's okay. I watched a talk given by Lorna Ryan, and she is a hypermobility specialist and an EDS clinical dietitian. So she really knows what she's talking about. She has a ton of talks up on the EDS Society's YouTube page. You should check those out too. So first are the functional gastrointestinal problems. It's quite a list. When we talk about the most common symptoms, we can divide that into upper GI and lower GI. First, if we were to look at dietary considerations. When you start dietary care, you want to pick your battles. I worked with a nutritionist, and she was very well versed in EDS. And it's hard because some of us can't tolerate dairy or gluten, or in my case, a high amount of fat, a medium amount of fat, a small amount of fat. We want to nourish that gut and its whole world of microbiomes. Focus on dietary fiber. I would be careful with this one, just from my own personal experience. The first gastroenterologist told me that if I ate kashi, like a lot of it, for 2 weeks, it was going to be awful. I was going to be uncomfortable, but just to push through, because once I got through those 2 weeks, my gut would magically reset itself. That did not happen. It wreaked havoc with my stomach. I started throwing up. Things basically just got worse. So that's when I went to the second gastroenterologist. There are also supplements that support our gut. Just be careful with this and make sure that none of them interact with your medications. For example, if you have gastroparesis, you stay away from red meat, alcohol, and stick with cooked soluble fiber. Trust me on this one. If it's constipation, you're going to want to focus on insoluble fiber, making sure you're properly hydrated, which I'm guessing most of us are. If you have nausea, GERD, or IBS, you can try ginger. You can try not having any carbonated fluids, although with some people, carbonated fluids actually help the nausea, so it's an individual choice. Red flags for dietary care. But with us, as always, we're very complicated. So be sure to work with an EDS nutritionist. They can be found on the EDS Society's webpage. You can just go to physicians for your state and hopefully find a nutritionist that is on that list. As always, Chronics, thank you for joining me. And remember, hang in there, don't give up, and don't take crap from anyone. I will talk to you next time.